Welcome, and thanks for joining an overview of cardiac health and the Quality Payment Program. Because Metastar is providing CME credit for this learning module, we need to inform you that no commercial support has been received and there are no planner or author conflicts of interest. For CME credit or a CME attendance certificate, you will need to complete the learning module and an online evaluation found on mpro.org. The Quality Payment Program was created by the Medicare Access and CHIP Reauthorization Act of 2015 and is a new approach to paying physicians and clinicians who treat Medicare beneficiaries. Under the Quality Payment Program, physicians and clinicians can choose from two payment paths: the Merit-Based Incentive Payment System, or MIPS, or the Advanced Alternative Payment Models, APMs. The Centers for Medicare and Medicaid Services is merging aspects of the Physician Quality Reporting System, the Value Modifier Program, and the Medicare Electronic Health Record Incentive Program to create MIPS. Beginning in 2019, MIPS will pay eligible physicians and clinicians for providing care based on 4 performance categories. If you decide to participate in MIPS, you will earn a performance-based payment adjustment to your Medicare payment. So, how does MIPS work? You earn a payment adjustment based on evidence-based and practice-specific quality data. This shows you provided high quality and efficient care by reporting information for the following categories: quality, improvement activities, advancing care information, and cost. The cost category will be calculated in 2017, but will not be used to determine your payment adjustment. With the healthcare industry's current focus on improving quality-based metrics, it is important to consider how managing your patients with high blood pressure and hypertension can help you to meet measures for several reporting programs. The Centers for Medicare and Medicaid Services Quality Payment Program streamlines previous programs like the Physician Quality Reporting System, or PQRS, the Value-Based Payment Modifier, and the Medicare Electronic Health Records Incentive Program into one merit-based incentive payment system, also known as MIPS. You are likely already taking steps to ensure that patients with high blood pressure and hypertension are being identified, diagnosed, and managed. Throughout this video module, we will talk about ways that you can use your current focus on cardiac health to support successful participation in the MIPS Quality Payment Program. Specifically, we will be highlighting examples of quality measures and improvement activities that align with cardiac health quality improvement. Eligible physicians that participate in MIPS will be evaluated on 4 program categories, the first of which is the quality category. The quality category replaces the PQRS program and will make up 60% of the MIPS score. Individuals will select and report on 6 measures, including 1 outcome measure for a minimum of 90 days, and groups will select and report on 15 measures for a full year. The CMS Quality Payment Program features a variety of quality measures focused around blood pressure and cardiac health. Selecting and working to improve these measures can support the care you are providing to patients and prevent future cardiac complications such as heart attack and stroke. Examples of these quality measures include Quality ID 204, use of aspirin or another antiplatelet. Tracks the percent of your patients 18 and older who have been diagnosed with acute myocardial infarction, have had coronary artery bypass grafting, or have had a percutaneous coronary intervention in the 12 months before the measurement period, or who have had an active diagnosis of ischemic vascular disease during the measurement period, and who had documented use of aspirin or another antiplatelet during the measurement period. Quality ID 226, Preventive Care and Screening, Tobacco Use Screening and Cessation Intervention, measures the percentage of patients 18 and older who were screened for tobacco use 1 or more times within 24 months and who received a tobacco cessation counseling intervention if identified as a tobacco user. Quality ID 236, Controlling High Blood Pressure, tracks the percentage of patients ages 18 to 85 with a diagnosis of hypertension and whose blood pressure was adequately controlled during the measurement period. Here, adequate control of blood pressure is identified as being below 140 over 90 millimeters of mercury. Quality ID 373, Hypertension, Improvement in Blood Pressure, measures the percentage of patients ages 18 to 85 with a diagnosis of hypertension whose blood pressure improved during the measurement period. The second MIPS Quality Payment Program category is Improvement Activities. This new category will make up 15% of your MIPS score. If your practice is a designated patient-centered medical home, you will automatically receive full credit for this category. Individuals will select and attest to completing up to 4 improvement activities, depending on the weight of the activities. Groups with less than 15 participants, or those in a health professional shortage area, will need to attest to completing 2 improvement activities. Performance of improvement activities must occur over 90 consecutive days in order to be able to attest completion during reporting. Selecting and working on improvement activities related to hypertension and blood pressure management can make a difference in the current and future health of your patients. Examples of improvement activities related to cardiac health include evidence-based techniques to promote self-management into usual care. This activity uses techniques such as goal setting with structured follow-up, teach back, action planning, and motivational interviewing to promote self-management of patients' health. Improve practices that disseminate appropriate self-management materials. This activity focuses on ensuring that self-management materials are provided at an appropriate literacy level and in an appropriate language to ensure usefulness to the patient. Participation in CMMI models such as the Million Hearts campaign. This activity promotes participation in Capability Maturity Model Integration, or CMMI models, such as the Million Hearts campaign's Cardiovascular Risk Reduction Model. Models like this one provide clear steps for promotion of behaviors that lead to improved performance. You can use tools from the Million Hearts campaign to identify patients with undiagnosed hypertension, create a hypertension treatment protocol for your practice, support medication adherence, and much more. To learn more about this campaign, visit millionhearts.hhs.gov. Implementation of medication management practice improvements. This activity promotes medication management to maximize efficiency, effectiveness, and safety. Examples of medication management activities may include reconciling and coordinating medications, providing medication management across transitions of care settings, integrating a pharmacist into the care team, and conducting periodic and structured medication reviews. Did you know? There are also improvement activities related to engaging with MPRO as part of Lake Superior Quality Innovation Network. Examples of these activities include IAPM6, use of Toolsets or other resources to close healthcare disparities across communities. For this activity, take steps to improve healthcare disparities. For example, use a population health toolkit or other resources defined by CMS, the Learning and Action Network, Quality Innovation Network, or National Coordinating Center. Refer to your local quality improvement organization for additional steps you can take for improving the health status of communities, as there are many steps to select from for satisfying this activity. QIOs work under the direction of CMS to assist eligible clinicians and groups with quality improvement and review of quality concerns for the protection of beneficiaries and the Medicare Trust Fund. IAPSPA 18. Measurement and improvement at the practice and panel level. In this activity, measure and improve quality at the practice and panel level. This could include one or more of the following: regularly review measures of quality, utilization, patient satisfaction, and other measures that may be useful for MIPS-eligible clinicians, practices, or groups. Another example would be to create benchmark reports and goals for performance at the practice level and panel level. MPRO can provide assistance to track and review quality measures and complete data benchmarking for goal setting. IABE3. Engagement with QIN-QIO to implement self-management training programs. For this activity, you can engage with MPRO to host diabetes self-management training programs. MPRO provides free 6-week diabetes personal action toward health workshops to reach patients in your practice. IAEPA4. Additional improvements in access as a result of QIN-QIO technical assistance. As a result of QIN-QIO technical assistance, perform activities that improve access to patient services. For example, invest in an on-site diabetes educator. The third MIPS Quality Payment Program category is Advancing Care Information. The Advancing Care Information category replaces the Medicare Electronic Health Record Program, also known as Meaningful Use, and will make up 25% of the MIPS score. Determine which participation method for MIPS you wish to use in 2017. Test pace, partial year, or full year participation, and then complete the requirements associated with that participation method. The final category is Cost. The Cost category replaces the Value-Based Modifier program and will count towards your MIPS score beginning in 2018. This category will evaluate eligible clinicians on measures related to resource utilization and will be calculated using Medicare claims. Implementing strategies that engage your entire staff in blood pressure management, utilizing electronic health record features, and understanding where to find resources are all ways to improve blood pressure control in your patient population. A best practice for helping patients improve blood pressure control is to follow the American Medical Association's MAP framework. MAP stands for Measure. Measure blood pressure accurately with a validated, automated device while ensuring the patient has adequate time at rest to avoid falsely elevated readings. Act. Act quickly to treat blood pressures that are not controlled. Patients with confirmed blood pressures of 140/90 millimeters of mercury or higher should be started on your practice's evidence-based protocol to guide treatment. And partner. Partner with patients, families, and communities to empower patients to control their blood pressure using accurate technique for self-measured blood pressure, as well as resources to support a healthy lifestyle and medication adherence. Additionally, sharing measured data with your staff, such as NQF-18, controlling high blood pressure, provides an up-to-date look at your patients who have their blood pressure levels under control. Reviewing this measure can help drive improvement. Remember that proper technique for measuring blood pressure in office and when patients are measuring at home is crucial to obtaining accurate blood pressure values. Check out the guide from the American Medical Association for 7 simple tips to get an accurate blood pressure reading. Did you know? There's a variety of resources to help your practice identify and manage all patients with high blood pressure and hypertension. MPRO provides free support to practices interested in improving cardiac health outcomes for patients. For more information about how MPRO can support you, visit mpro.org. To learn more about the Centers for Medicare and Medicaid Services Quality Payment Program and eligibility criteria, visit qpp.cms.gov.